AI is revolutionizing healthcare in so many different ways. It can go in and it can look at X-rays. It can actually, they're actually working on the technology where you can cough into your phone and it can really diagnose whether even if you have COVID or not. That came from the past pandemic that we all went through. And I am here with Dr. Joanna Vance, where she is a healthcare professional. And Joanna, how do you see AI being used in healthcare these days?
Yeah, that's a great question, George. Just to back up one step from what you said, I just want to first quickly define AI in general. And so that's the science of making intelligent machines that can do things that previously only humans could do. And so, like you mentioned, speaking into your phone. So we've all used AI these days. So if you've ever asked Siri on your iPhone or asked Netflix to make a suggestion for movies that you might like, or use Google Maps to get you to your destination, we've all been using AI in our lives in general for quite a while now. And so we're really seeing this become a very big thing in healthcare. So data analysis, clinical decisions, diagnosis, treatment. I'll give you two quick examples of how I'm seeing that come up. So natural language processing is a really big thing in AI these days. So that's used a lot in healthcare. So unlike the old school dictation where a provider might just speak into a microphone and that would be translated and that's all there was to it. Natural language processing is working with a computer that can actually understand and process and do things with natural human language. And so that's making note-taking and communication with patients far more efficient than it used to be. So that's a really big use of AI in healthcare. And then lots and lots of examples. Another one is in radiology. That's not so surprising since radiology is such a technology forward field to begin with, but using AI assistants to look at images and diagnose patients, abnormalities on images, maybe tracing tumors to see if they're growing, shrinking, that kind of thing. So much easier with machines. And even just for general health, like measuring the amount of fat around muscle tissue, just looking at things that are difficult with the human eye, but that a machine can do immediately and process and work with that information. So we're just seeing AI everywhere in healthcare these days.
So you're saying that healthcare practitioners, let's say a nurse or a doctor, can actually do charting simply by the conversation that they have in the room. Exactly. A machine learning algorithm can look at X-rays and say, this is, precancerous, cancerous, or benign things to that level.
Yes, now, to that level, for sure.
Is that always reaffirmed by a person, or do we just go with it?
Nope, that's a great question. So yes, thank you for asking that. So the reason that's really important for people going into healthcare as a profession is that AI is not going to replace doctors, nurses, providers, administrators, anything like that. Rather, places are really looking to hire professionals who are well-versed in AI. So instead of replacing that, a lot of jobs, they just want to hire providers who can use AI, who are technology forward, who are interested, aware, knowledgeable about how to use some of these tools. So of all of the job skills going into tomorrow, being able to use AI as a healthcare provider is huge. That's probably the biggest one.
Oh, so if I'm a student, that what you just said makes me learning AI as a student really apply. So what are some other reasons? So I'm a student. Why do I care about AI, and why do I want to know about it?
Well, for one thing, it's interesting. For another thing, it will make you better at doing your job. And third, your peers are going to know about it. So if you want to be competitive in the workplace and you want to get those great jobs of the future, then that's something that you need to stay really aware of, because your peers are going to be going into job interviews and professional settings and networking situations where they're able to discuss AI, where they're able to talk about some of the things that are happening right now in healthcare with AI, and they're able to talk about some of the technologies that exist, how they're being used in the workplace. And so if you want to stay competitive and have those fun, forward, future looking jobs, it's just something you're going to need to be able to discuss in your interview process, your hiring process, and with your professional network.
I love that thought process, because one of quote that I heard somebody say. I don't know who to attribute it to, but I heard it. And he said, "Your job's not going to be replaced, or you're not going to be replaced by AI, but you might be replaced by somebody who knows how to use AI." Right?
Absolutely. Absolutely. Yes. So, really important to be able to go into those professional settings with some conversational skills about AI, because it's 100% something that's going to come up. And you would be very hard pressed to sell yourself, promote yourself, if your response was, "Well, I'm not very familiar with that." It would probably be a pass on to the next candidate, because that's just so important in our future thinking workforce.
So to that end, you're putting on a free professional
Mhm.
development course of AI, or it's understanding AI and in the healthcare professions, right?
Yes,
And
you've got
people are
it.
going to be able to earn a badge. So can you
Mhm.
tell us a little bit about that?
Yes, I'd love to. Thank you. So this is, as you said, completely free for students, and anyone can take it too. I've actually had some of the faculty in my department, in the Bachelor of Science and Health Science, say that they're interested in taking it, because not only for people going into more of a hands-on clinical administrative type of role, it's important for us as faculty too. So I've had some of my peer instructors say, "Hey, I'm going to sign up for that. That's important. I know I need to know about that, because I want to work with my students that way." So um, this is for anyone who's interested. It's not for a specific group, but I think it's really important for our students. It's a 7-week workshop. It's completely free. And so, one of the main things, and I'm facilitating this workshop, and one of the main things I want to make sure everybody comes out of this with is these conversational skills I'm talking about, as far as knowing what's going on with AI in healthcare, knowing how it's being used, where it's being used, what are some of the names of these technologies, what kind of practitioners use them. Because, as I mentioned, this is just stuff that's going to come up, and being well versed in just conversation, knowledge, skills to talk about this kind of stuff, apply it on the job, is going to be so important to keep students competitive in the field that they're in, if they go into anything related to healthcare. So each of the 7 weeks, we're going to be reading a very current article. So a 2024 article about how AI is currently being used in some facet of healthcare. And then we're going to break that down. We're going to have a group discussion about it every week. And we're going to have the ability to personally reflect on what we've done for the week. So each week we're going to move on to a new topic, 7 weeks. And after 7 weeks, you should have a pretty good idea of what's going on with AI in healthcare right now in 2024. And so hopefully we can do this again, and articles will be refreshed at that time. So we're staying on them. We're not using articles from 3 years ago. We're talking about what's going on right now today.
Nice. I love that, because you brought up the point about discussion. And if you're going into anything, any field, let
Mhm.
alone healthcare where AI is big, you have to be able to discuss it. Yeah, you have to be able to have a substantive discussion on the topic, not just something where you scratch the surface and say, "Oh, where you throw out some acronyms, NLP, ML."
That's
You
right.
have to be able to dive in deep, right, and actually understand what's happening. And
Yeah.
your program you put together actually has people discussing for 7 weeks, so they're gonna get that.
Yep. We're going to
That is
practice
so
skills.
amazing.
Yep. Yep. Just like anything else that's new, we got to get in there and practice those skills, practice talking about these concepts, practice applying critical thinking. So with the discussions, we're going to have participants bringing in other information, citing that information. So we're going to practice using critical thinking. We're going to practice using evidence. We're going to just practice having these
Oh,
conversations, so that we all feel comfortable having these kinds of conversations about what is happening with AI in healthcare, and where is this headed in the future, and what do I think about this? Because those are questions that all candidates and newer professionals in the field are going to probably have to answer to.
that is amazing. And not only will you be able to have those skills, but you're also going to earn a badge. You see the badge at the bottom of the page here, where it's understanding AI almost said instructional design, AI in healthcare
Mhm.
and healthcare professions. So the badge, it's a micro credential that you can put on any, LinkedIn, your resume. So it proves that you know something about that. You're able to understand how AI is affecting your healthcare profession, and it's
Yeah.
really uh, it's electronic. I want to say a physical way to show people. So you're showing people that you have these skills, and it comes from LAPU, and it was a 7-week course given by Dr. Vance. So it's really a nice way to prove or show what you know, is what I like to say, to
Yeah.
prove that you do have the skills.
And what I like about that too is, so you can take the badge and put it on your resume, or put it on your e-portfolio, or put it on, your LinkedIn site. And it's really a conversation starter. And so it really gives you a way to be proactive about this, rather than just responsive to the conversation. It's a conversation starter. It's a, hey, I'm doing these things to make sure I'm prepared for the technology and workforce of tomorrow. Here's some evidence of that. Let's have a conversation about it. So it really is a proactive approach, which I think is just a fabulous way to showcase motivation, dedication, forward thinking. So I'm pretty excited about that.
Right. Yeah, that's great. Yeah. So if you have this micro credential, you can say, hey, not only am I interested in AI, but you know what? I'm forward thinking. I already did something about it.
That's right.
It's going to be a lifelong adventure, of course, but you got to start. You know, that's amazing.
Yep. So in addition to whatever program you're pursuing, it's kind of, hey, I'm also willing to do extra stuff and look forward. And, this is what I know, and this is what I can contribute. And I can jump right into whatever conversation we're having in the workplace about this.
That is amazing. So we will have that link in both the description, and we'll pin it to a comment as well on YouTube, so people can just click it, and then they can right away just enroll in your course. This one happens to start March 11th, but we're hoping to have many, many more going forward. So, and if anybody else is interested, if that strikes your interest, Dr. Vance also works within the health sciences program at Los Angeles Pacific University, where there is a health sciences BS, health science AS, so associate's degree, bachelor's degree, and pre-nursing health sciences, as well as a public health, or an MPH, a master in public health degree. And Dr. Vance, you teach primarily in the health sciences BS degree, or do you teach in a little bit in all of them?
A little bit in everything, but right now most of my classes are in the Bachelor of Science and Health Sciences program. So I'm happy to, I'm trying to encourage all of my students in those courses to join in this workshop. I think it's going to be a really nice way for us to get together and maybe interact with some peers that you haven't interacted with before for these kinds of discussions. So very happy to answer any questions that anyone has about the workshop as well.
Well, amazing. So we have a workshop, we have programs, and it's really affecting students now, not future students right now. So they get that future proofing of their career, if you will. So I appreciate you coming, letting us know about this amazing program that you're putting on. And this is what learning feels like.
Thank you. Yes, I'm very, very excited. I'm learning as well, because like I said, the things that we're reading and looking at in this class are current, as in, a couple weeks ago. So every time new work is being published, I'm staying on top of that. So it's causing me to learn every day as well. So it's pretty exciting.
Awesome. Learning every day.